Birth injuries include extensive caput succedaneum, cephal hematoma, subgaleal hemorrhage, nerve pulses, and fractures. The presentation varies depending on type and site of injury. Excessive traction may result in injury to the brachial plexus and may also be associated with fracture or injury of the humerus or shoulder joint. Causes include difficult delivery, including instrumental delivery, and the symptoms are swelling of the head, inability to move a limb properly, and also pallor. The signs that are usually elicited are extensive caput succedaneum, diffuse swelling of the presenting part of the scalp that may extend beyond cranial suture lines. That's cephal hematoma, and also large swelling of the scalp that is restricted to one half and does not extend beyond the midline, as subgaleal hemorrhage, and also diffuse swelling of the scalp, which may result in a distorted shape of the head and face, and severe pallor, jaundice, nerve injuries, Erb's palsy, as whole upper limb does not move, and there is movement only in the fingers, and also Klumpke's palsy, as fingers of the affected hand do not move. Normally it's a claw hand, but there is active movement of the arm and forearm, and fractures to reduced movement of affected limb, swelling of the affected limb, abnormal position of limb, pain and tenderness on movement of limb. Investigations are hemoglobin level for subgaleal hemorrhage, serum bilirubin if jaundiced, and X-ray of relevant part if fracture is expected. The treatment objectives are to arrest further bleeding, to treat complications of anemia and jaundice, to re-establish normal movements in affected limb, and also to promote normal healing of fracture. Non-pharmacological treatment for extensive caput succedaneum, reassure parents and leave swelling alone. There's always spontaneous resolution over 3 to 4 days. For cephal hematoma, reassure parents, leave swelling alone, and this to there's spontaneous resolution with time, and do not perform incision and drainage. Phototherapy if jaundiced, and for subgaleal hemorrhage, phototherapy if jaundice levels require this. For nerve injuries, physiotherapy is required. For fractures, may require splinting. Pharmacological treatment for cephal hematoma and subgaleal hematoma, to reduce bleeding, you give phytomenadione as vitamin K IM, 1 milligram start, even if baby received dose at birth, and also to correct anemia if HB is less than 12 milligrams per deciliter. Blood transfusion is required as 15 to 20 milliliters per kilogram. Referral criteria: refer severe cases to an appropriate specialist facility.